Hemorrhoidal disease is one of the most common medical problems of mankind. 8 out of 10 people in the United States will suffer from hemorrhoids in their lifetime. In fact, over half the men and women over the age of 50 in this country currently have some form of symptomatic hemorrhoidal disease. But because this is viewed as an intensely private ailment, treatment of which can be painful and intrusive, patients are reluctant to talk about the condition with their physicians, and that could represent a significant loss of opportunities for your practice. Presenting Ultroid, the complete hemorrhoid management system, designed to make hemorrhoid management an outpatient procedure. Ultroid safely and effectively treats internal and mixed symptomatic hemorrhoids of grades 1 through 3 and some of grade 4. This painless, cost-effective modality requires no anesthetic and reduces patient anxiety over treatment. Clinical efficacy has been proved in thousands of cases. After treatment, patients are ambulatory and there is no disruption to their lifestyle, but most importantly, Ultroid provides a solution to the problem of hemorrhoidal disease, not just the symptoms. In order to distinguish between hemorrhoids and other anal rectal problems such as fistulas, fissures, and neoplasia, the physician must have a clear understanding of the anatomy of the anal rectum. The upper end of the anal canal begins above the dentate line. Below that, the lining changes to a modified skin called the anoderm. Surrounding the anal canal are masses of vascular tissue. These hemorrhoidal tissues are normal anatomical features of the anal canal and do not constitute a diseased state. The vascular cushions lying below the dentate line are supplied by the external hemorrhoidal plexus vessels and have the potential of becoming external hemorrhoids. Although they are generally asymptomatic, some are associated with thrombosis and cause pain. In those cases, surgery is the treatment of choice. But only a small percent of all symptomatic hemorrhoids are external. Internal hemorrhoids lie above the dentate line, supplied from the internal hemorrhoidal plexus vessels. A combination of internal and external hemorrhoids that have vascular communication between the two plexus are called mixed hemorrhoids. Both internal and mixed hemorrhoids can be treated effectively with Ultroid. Somatic sensory innervation of the anoderm extends upward into the anal canal to the dentate line. A transitional zone extends approximately 2 centimeters below the dentate line, which demarcates the anal-rectal junction. These nerve endings decrease in this area until they are absent. That's important to hemorrhoidal therapy with Ultroid because treatment above this transitional zone is painless. Notice that the dentate line is gathered along the fold of the rectal lining rather than being straight. In rare cases, occasional sensory nerve endings extend above the dentate line. It's therefore important that you test for sensitivity before determining the treatment site. What causes hemorrhoids? Pathological changes to the anatomical arrangement of normal vascular tissues, ranging from man's upright posture, constipation, diarrhea, straining of defecation, pregnancy, athletic exertion, hard physical labor, obesity, or even a sedentary lifestyle. These all can result in repeated engorgement of these tissues. Hemorrhoids are also attributed to the normal aging process, fiber-poor diets, and genetic factors. Hemorrhoids caused by pregnancy usually recede by themselves. Those caused by poor bowel habits progress from initial symptoms of painless rectal bleeding to prolapsed tissue, which spontaneously return up the anal canal when straining ceases, to painful, permanently prolapsed tissues. Ultroid is not recommended for patients who are pregnant, have pacemakers, or are subject to bleeding disorders, undergoing anticoagulant therapy, suffering from an active local infection, suffering from inflammatory bowel disease, immunosuppressed, or patients who have received an organ transplant placed in a lower abdominal quadrant. Hemorrhoidal disease is graded from the least severe, grade 1, to the most severe, grade 4. A grade 1 hemorrhoid is an abnormal prominence of vascular tissue in the anal canal. Grade 1 hemorrhoids are painless with bleeding during bowel movements. A grade 2 hemorrhoid is one which prolapses through the anus with straining, but spontaneously reduces. Hemorrhoids which have prolapsed but require manual reduction are categorized as grade 3. And finally, the most severe hemorrhoids are grade 4. These are fixed, non-reducible lesions that are permanently prolapsed.